Let me first note, before introducing our panelists here, that this is a fora that is co-sponsored with the School of Public Health and Human Services here at GW, and thanks to their leadership, we're trying to address issues that are at the convergence point between health and security. Traditionally, when you look at the national security planning tables, it has a whole different host of characters around it. Then when we start looking at the public health tables, they too have a whole different host of characters around it. The issues we're dealing with today obviously require that the two constituencies and also the two disciplines come together. So where does health meet national security, homeland security, and vice versa? It also means you've got a whole new set of characters that need to be part of our planning and response efforts. And I think we have a panel assembled here today to help us highlight and accentuate many of those opportunities and also some of the challenges. So I don't want to suggest we're ready for an absolute lessons learned approach. It's obviously in the early days, and it could arise in different ways as we look ahead. But I think there are some more than critical issues that we can all turn to. So let me turn now to our panelists. Let me also note to our webcast viewers, welcome. To those on Twitter, like Queen Rania in Jordan, we're also Twittering. If there are questions that come through that, we'll try to get to those afterwards. And as with all of our sessions, we tend to focus more on conversation. There are not going to be a whole lot of PowerPoints here, but thoughts and ideas from leaders in the field. And we want to make sure it's not a monologue, but a dialogue engaging all of you, since we've got some real expertise that cuts across so many various disciplines in the room with us today. So I thought we'd start out with Dr. Paul Jarris, who, as many of you know, is the Executive Director of the Association of State and Territorial Health Officials. Obviously, he's speaking for those that are really on the front lines of these challenges. We often focus on what the feds are doing, but ultimately the rubber hits the road with our state and local officials, and he'll try to give us a snapshot on what he feels that interface has been between federal, state, and local officials, how we can enhance and synergize those efforts better, looking from an epidemiological surveillance standpoint all the way through to how we address vulnerable populations, including the uninsured. So how these two come together. Paul is also a doc and has a family practice, and also, I think, uniquely has a shelter for homeless adolescent youth that he helps support. Following Paul, we'll hear from Bob Kadlec, an old co-conspirator. I think we've worked on bioterrorism issues together for well before 9/11. I can't remember exactly when, but served on numerous committees together. Bob, I think, is uniquely qualified to look at some of the preparedness and response efforts, as he was the former Special Assistant to the President for Biodefense. He was also very active, along with his predecessor, Rajiv Venkaya, in looking what the national strategy for pandemic influenza would look like, and ultimately going beyond just the strategy itself to look at implementation and where we stand, where we are, and where we hope to be. So Bob will follow Paul. And I might note, as a former colonel as well as a doctor. Following Bob Kadlec, we have Dr. Jeffrey Levi, who, as many of you know, is the Executive Director of the Trust for America's Health. And I think their program in particular does a wonderful job annually assessing our capacities and capabilities, and sometimes coming up with report cards, which I might note he's also a faculty member here at the School of Public Health and Human Services. And Jeff also comes at this issue from not just an academic perspective, but also served in the White House working on HIV policy issues, and I think brings an awful lot to the issues. And last but not least, we have General Philip Russell, who will round out the panel. General Russell served in the U.S. Army Medical Corps from 1959 to 1990. Don't want to shed any secrets on how long you've been at these issues, but clearly a true warrior. when looking at these sorts of matters. General Russell was also integral post 9/11 in the anthrax crimes in particular of October 2001, addressing some of the stockpiling matters as it pertains to vaccines and other medical countermeasures against biological warfare agents. I think there's a lot of discussion on vaccines, and I'm not sure that our planning assumptions are always equal to what the real capacities are. So I think that General Russell will shed some light on how we prioritize vaccination programs, how we can communicate if we need to do so, a vaccine campaign, and what some of the opportunities are and what some of the challenges are. But also, where is the supply itself, and do we have the capacity to ramp up from the ordinary to the extraordinary? Without further ado, I've never had an unspoken thought. I want to turn it over to our panel. So we'll 10 minutes either, 10 to maximum 15. The tyranny of time requires I be a bit of a tyrant. I want to make sure that everyone has an opportunity to get their thoughts out and then open it up to the audience. So.